and thank you for joining us for a special summer series of COVID-19 briefings. Every week for the foreseeable future, Acting Health Commissioner Dr. Cheryl Bedegal will provide you with the latest update on the city's response to the COVID-19 pandemic. Following her prepared remarks, we will provide those remarks in Spanish. Then we'll take questions from the press. Today we'll be ending at 11:30. Now let's get started. Dr. Bedegal, you have the floor.
Great. Good morning, everyone, and thank you for joining us. So I wanted to bring us back together today because the pandemic in Philadelphia has taken a turn that none of us wanted to see. Cities and states across the United States, countries around the world have seen their COVID case counts rise rapidly due to the Delta variant. We believe that the Delta variant is now the dominant strain of COVID in Philadelphia, and that's what's causing our case counts to rise as they have been. I want to be very careful about how I describe the situation that we're in now. The number of cases we're seeing right now is about what we saw last summer and is much lower than when things were at their worst. What concerns me isn't just the number of people who are testing positive or the number of people in the hospital. I'm concerned about how quickly those numbers have risen. They doubled between July 12th and July 19th, and then they doubled again between July 19th and August 1st. We announced the strong recommendation for everyone to mask indoors regardless of vaccination status based on that initial doubling of cases in a week, coupled with the situation around the country and a slight rise in hospitalizations among children. The rise in cases slowed very slightly, but not nearly enough. We need to come together as a city once again to fight back against this new surge. But this time we have better weapons. We understand the virus better, how it spreads, how we can protect each other and ourselves. And we have plenty of safe, effective, free vaccines available all over our city to protect us. I'm going to be completely open here. Being fully vaccinated doesn't mean you can't get COVID. You still can, but your chances of getting COVID are much lower, only about 1/8 the chance of someone who is unvaccinated. And being fully vaccinated means you are much, much less likely, but 25 times less likely to get seriously sick or end up in the hospital if you do get COVID. Because of that real protection and the fact that so many people have been vaccinated now, almost everyone in the hospital with COVID these days is unvaccinated. But vaccines aren't the only protection you need now that Delta is spreading in our city. To reduce your chances of getting COVID even more, wear a mask when you're inside in public spaces, whether or not you are vaccinated. We know for a fact that wearing a mask when you're around other people in public, especially indoors, reduces your risk. Avoid crowded indoor public places. The more people in any one space indoors, the more likely that someone in that space has COVID and can spread it to others. Get tested if you start to feel sick and quarantine away from everyone else until you get your results to help protect those around you. And if you test positive, you need to isolate away from everyone for 10 days after you start to feel symptoms. That's going to be what helps protect those around you. If we do all of these things, we can stop this rise in cases before it gets worse. Vaccines, mask use, avoiding crowds, testing and isolation and quarantine have solid science behind them. We are all tired of this pandemic, and the social isolation it's brought is also a real risk to people. So keep in mind the ways of socializing that are safer. Getting together outside, limiting your socializing to those who are vaccinated. When you do get together with people who aren't vaccinated, limit the numbers of people to lower your risk. Hold gatherings that include children too young to be vaccinated outdoors or with masks on. And mask if you attend any kind of a public indoor event. We know that it's easier to buy into something that's hard if you know why you're doing it, which is why starting tomorrow, I've directed my staff to begin updating the testing and vaccine dashboards on the phila.gov/COVID website every weekday, and to start posting the daily numbers of cases and vaccine administrations on our Twitter account every weekday. You should know how things are going, and you should have someone there to help you interpret what's going on. That's why we're restarting these weekly press conferences. I'm sorry we don't have the days and times set just yet, but it's important to be here each week so we can all get through this together. Thank you so much for all the work each of you do to help get the word out. You are very, very powerful messengers that we need right now. Next, we'll have my remarks presented in Spanish, and then we'll open it up to questions. Thank you.
Buenas tardes, las palabras de la doctora Berigó. Quiero volver a unirnos hoy porque la pandemia de COVID en Filadelfia está tomando un paso que ninguno de nosotros quería. Ciudades y estados de todo Estados Unidos y países en todo el mundo han visto aumentar rápidamente los recuentos de casos de COVID debido a la variante Delta. Creemos que la variante Delta es ahora la cepa dominante de COVID en Filadelfia y eso es lo que está causando que nuestros recuentos de casos aumenten. Quiero tener mucho cuidado con cómo describo la situación en la que estamos ahora. El número de casos que estamos viendo en este momento es aproximadamente lo que vimos el verano pasado y mucho más bajo que los casos estaban en peor momento. Lo que me preocupa no es solo el número de personas que están dando positivo o el número de personas en el hospital. Me preocupa lo rápido que han aumentado esos números, duplicándose entre el 12 y 19 de julio y luego duplicándose nuevamente entre el 19 de julio y el 1 de agosto. Anunciamos la fuerte recomendación de que todos usen máscaras en interiores independiente del estado de vacunación en base a esa duplicación inicial de casos en una semana, junto con la situación en todo el país y un ligero aumento en hospitalizaciones entre los niños. El aumento de los casos se desaceleró muy ligeramente, pero no lo suficiente. Tenemos que unirnos como ciudad una vez más para luchar contra esa nueva oleada. Pero tenemos mejores armas. Entendemos mejor el virus, cómo se propaga y cómo podemos protegernos unos a otros y a nosotros mismos. Y tenemos muchas vacunas seguras, efectivas y gratuitas disponibles en toda nuestra ciudad para protegernos. Voy a ser completamente abierta aquí. Estar completamente vacunado no significa que no puedes ser infectado con COVID. Todavía se puede, pero sus posibilidades de contraer COVID son mucho menores, solo una octava parte de la posibilidad de alguien que no está vacunado. Y estar completamente vacunado significa que es mucho, mucho menos probable que te enfermes gravemente o termines en el hospital si contraes COVID. Debido a esa protección real y al hecho de que tantas personas han sido vacunadas ahora, casi todas en el hospital con COVID en estos días no están vacunados. Pero las vacunas no son la única protección que necesita ahora que Delta está extendiendo en nuestra ciudad. Para reducir aún más las posibilidades de contraer COVID, use una mascarilla cuando esté dentro en espacios públicos, esté o no vacunado. Sabemos a modo de hecho que usar una máscara cuando estás cerca de otras personas en público, especialmente en interiores, reduce tu riesgo. Evite los lugares públicos interiores abotorados. Cuantas más personas haya en cualquier espacio interior, más probable es que alguien en ese espacio tenga COVID y pueda contagiar a otro. Hazte la prueba si empiezas a sentirte enfermo y en cuarentena, lejos de todos hasta que obtengas tus resultados, para ayudar a proteger a quienes te rodean. Si usted da positivo, usted debe ser aislado lejos de todos durante 10 días después de que usted comience a sentir síntomas, que ayudará a proteger a los que te rodean. Si hacemos todas estas cosas, podemos detener este aumento de casos antes que empeore. Las vacunas, el uso de mascarillas, la evitación de aglomeraciones, las pruebas y el aislamiento y la cuarentena tienen sólida ciencia detrás de ellas. Todos estamos cansados de esta pandemia y el aislamiento social que ha traído también es un riesgo real para las personas. Así que ten en cuenta las formas de socializar que son más seguras. Reunirse afuera, limitar la socialización con aquellos que están vacunados. Cuando se reúna con personas que no están vacunadas, limite el número de personas para reducir su riesgo. De celebración de reuniones en las que haya niños demasiado pequeños para ser vacunados al aire libre o con mascarillas puestas. Enmascarazamiento si asiste a un evento público en interiores. Sabemos que es más fácil comprar algo que es difícil si sabes por qué lo estás haciendo. Es por eso que a partir de hoy he ordenado a mi personal que comience a actualizar los paneles de pruebas y vacunas en el sitio de web phila.gov/COVID todos los días de la semana y que comience a publicar los números diarios de casos y administraciones de vacunas en nuestra cuenta de Twitter todos los días de la semana. Debes saber cómo van las cosas y debes tener a alguien allí que te ayude a interpretar lo que está pasando. Por eso estamos reiniciando estas ruedas de prensa. Lamento que los días y las horas no están disponibles todavía, pero es importante estar aquí cada semana para que todos podamos superar este asunto. Muchas gracias. Thank you very much.
Thank you very much, Ms. Zelli. We'll now move to Q&A. Reporters are asked to limit their questions to 3 or fewer. Given our short time today, we ask that you stick to the topic at hand. If there are any reporters who do not get the opportunity to ask questions, please follow up with us by email and we'll get you an answer. First up, we'll go to Lauren Make from Channel 10. Lauren, you should be able to.
I believe I'm unmuted. Can you hear me?
Perfect. Yep.
Okay, excellent. Dr. Bedigal, you probably saw that just this morning, New York City has announced that it's instituting a new plan where it will require proof of vaccination for certain things, including indoor dining, indoor gyms, that sort of, and certain entertainment venues, that sort of thing. Is that something that Philadelphia is considering or would consider?
So that's not something we've been actively discussing. You know, we're certainly very supportive of vaccination, but we have not been actively looking or talking about something like that on a city level.
Is it something you would consider if things get worse? Are you going to be talking to New York and watching how their rollout goes?
I mean, you know, this situation is very fluid. I feel like I'm going to be saying that a lot during this discussion. I don't want to take anything off the table, but it's certainly not top of mind as the next step or a logical next step for us here in Philadelphia.
Is there anything that makes Philadelphia different than New York that would make you say that won't work here, even though they're trying it there?
It's not so much about Philadelphia being different from New York as, although I will say, you know, Philadelphia is part of a larger multi-county area. And I think that for us having a patchwork of different key cards or, you know, would be challenging. If you imagine, you know, would you have one in Montco and one in Chesterfield and so on. But, you know, again, it's not, as we think about what the range of options for response are, it's not something that we're actively discussing.
Okay. Last thing then, some private businesses are requiring proof of vaccination for something, whether it's to eat in their restaurant or some other business. Is that a good idea? What would be your message to businesses considering something like that?
I mean, again, we're very, very supportive of vaccination. I can't comment on the legality of particular mandates for private businesses, but you know, I would understand that a business might be concerned about their staff and their customers, and you know, certainly if that encourages people to get vaccinated, that's all to the good.
Thank you.
Thank you very much, Lauren. Next up, we're going to move to George from 6ABC. There you go, George.
I think you should be able to hear me. Good morning, everyone. Good morning, Dr. Bedigal.
Good morning.
So kind of following off of Lauren's question. So even though at this point you said it's not off the table necessarily, what about a mask mandate? Are people, places, restaurants, gyms, I mean, are they potentially looking at reinstituting any type of mask mandate, even though the CDC at this point is strongly recommending it because of the transmission levels?
Right, so currently the city is strongly recommending masking for everybody in any public indoor site. There are individual businesses, and there have been since our mask mandate went away, that have continued to ask all of their customers to mask. And we are supportive of any business that would like to do that. We have signs posted that they can download from our website to make that process easier. It's certainly up to an individual business. If they would decide to do that, they certainly can. And we would ask that customers honor those requests.
At this point, you're not saying or seeing a potential mask mandate implemented back in the city.
So there are lots of things we're discussing right now as we look at the numbers with concern. I wouldn't rule out a mask mandate, but we are not, as of today, we are not about to do one.
This may be a question you may not have the numbers for, but when you talk about the vaccinations and the supply, are there any risks of any particular doses expiring at this time as the vaccination rates have slowed down significantly?
The amount of time that we can keep the J&J, which is the one that was closest to expiration, was extended again recently. So we really don't have any shortages of vaccine. That should not be a concern for people. There's plenty of vaccine. There's plenty of Pfizer, there's plenty of Moderna, and there's plenty of J&J. There are hundreds of sites around the city that would eagerly vaccinate any Philadelphian who would like to come in and get a shot. So none of those concerns, which were so important early on, are things we have to worry about at present.
That's all my questions. Thank you.
Thank you so much, George. Next up, we're going to move to Laura McChrystal from the Inquirer. Laura, you should be able to unmute.
Hi. I'm wondering for large scale events that might be coming up, such as Made in America or the Broad Street Run. While those are outdoors, they're big events. Has there been any discussion as to whether the city would cancel them or issue new guidances?
So, as I just said, it's a very fluid situation right now. Numbers were low. They've only started to increase recently. So we're taking a look at everything. The Broad Street Run, I believe, did just announce a hybrid option, which is terrific for people who don't want to. I'm not affiliated with the Broad Street Run, but I believe that was just announced. Outdoors in general is much safer than indoors. But there is that concern that if you're packed into a crowd, and Delta being more transmissible, that might be a concern. Wearing a mask, if you are going to be outdoors in a crowd, is probably a good idea. But we're actively talking to organizers and stakeholders around the city, trying to figure out where things are headed and what, and like you, following the science day to day as it changes.
Okay. And is there a chance that we could soon see, guidance changing for, events that are even permitted to happen, such as like weddings? Those are large, indoor events that were banned for a long time.
So, I can't tell you that guidance won't change. I think one of the things we've all learned with this pandemic is the things we know today change tomorrow. And that's been true again and again. I will tell you that our commitment is to keep Philadelphians safe, but also to keep the restrictions to the minimum that's necessary for that safety. We know that weddings and celebrations matter to people a great deal. We are not looking to make people's lives miserable. So, we'll try to do what's necessary, but to minimize restrictions where possible.
Okay, and lastly, is there anything, given the rising cases, anything new or different that the city is doing to encourage vaccination for the unvaccinated?
So doing lots of things to encourage vaccination. I mean, there are pop-up clinics. We're doing a collaboration with the school district to help get our teenagers vaccinated before the school year started. And that's been really exciting to put together. What else? There's advertisements, there's incentives. We are working now that President Biden made the announcement that we can increase incentives with CDC funding from $25 to $100. We're working to put together a plan to do that. Hope to have that together and approved by CDC shortly. Kind of whatever we can. I think this is one of those times when we need to do everything. There's not one solution that's going to work for every Philadelphian who remains unvaccinated. So really trying to think out of the box and come up with every possible strategy that will get more people vaccinated.
Thank you.
Thank you so much, Laura. Next up, we're going to go to Isabel Sanchez in Telemundo 62. Isabel, you should be able to unmute.
Alrighty, thank you so much. Doctor, is there specific neighborhoods or zip codes that you are more concerned about that either have lower rates of vaccinations or are seeing more hospitalizations?
Yeah, I mean, in general, as is true with pretty much every health outcome, the lower vaccination rates track with poverty in our city. So if you think about where our lowest income areas are in North and West Philly, some areas in the lower Northeast, that's where we have consistently seen lower vaccination rates, higher case rates in general, higher hospitalization and death rates. So those are the areas that we've been focusing on for the last several months in terms of our vaccination efforts. And certainly, one of the things that's been encouraging is that from age 45 and up, we don't have disparities between race and ethnicity in vaccination in Philly. And that is something that we're all really proud of achieving. It is not just the health department, it is partners all across the city. It's the work you all have been doing. But we still have it for our younger adults. We still have some gaps that we need to close. So really trying to get those vaccine clinics where people are, our Philly Counts ambassadors out, knocking on doors and talking to people and calling people, community partners out, trying to reach people, but every way we can.
Wonderful. My last question would be, is this time around the number of cases that we're seeing different than what we saw before? Before, it was elderly folks who were suffering. Are we seeing a different trend this time?
Yeah, this is our young adults. This is the people who remain unvaccinated. So the highest rates and the highest increase are in adults 20 to 34. And, from what I hear from colleagues around the country, that's who's in the hospital. They're taking care of people in their 20s who are on ventilators, and that's new. And that's not necessarily because Delta's worse. There's some studies that show that it may be worse, but overall it's because that's who's still getting sick with COVID, as opposed to, maybe an infection, although it's much less likely, but maybe an infection that's more like, a runny nose and maybe a slight fever and having to stay home versus being in the hospital, being on a ventilator, people saying goodbye to their children, these horrific stories. And I think young adults have felt pretty safe through this. And, that is not as true as we want it to be.
Thank you so much. I appreciate it.
Thank you very much, Isabel. Next, we're going to move to Mike D'Onofrio from the Philly Tribune. Go ahead, Mike.
All right, thanks. Doctor, how about how is this new variant and the rise in cases affecting African-American Philadelphians? Are you still seeing African-American Philadelphians being disproportionately, getting the virus and dying from it like they were last year?
So fortunately, we haven't seen a spike in deaths yet. Although, this is a slow disease. So we first see a rise in cases, then we see a rise in hospitalizations, then we can anticipate there would be some deaths. We are seeing not what people have called uncoupling, where you see a rise in cases, but you don't see a rise in hospitalizations. So we don't have full uncoupling, but we don't have nearly as steep a rise in hospitalizations as we do a rise in cases. And I think that's vaccination. That's the fact that the people getting infected are younger. So there's definitely still a large group of young Black adults in our city who are at risk and who are getting infected, some of whom are ending up in the hospital. We're basically trying to, it's a race against time with vaccine, trying to vaccinate that population and protect them before this spreads further.
But just to be sure, are you seeing African Americans being disproportionately affected, especially these 24 to 34-year-olds?
Yeah, so there are more cases in African Americans than among other groups.
How about, are you seeing any spread, or are you tracking, I guess, are you seeing any super spreader events coming out of church services in recent weeks or months?
Not that I'm aware of, no. We certainly earlier in the pandemic did see some events like that. A lot of our churches people did move to remote services, and then a lot of them have really taken serious precautions.
And then maybe just lastly, are you considering or actively talking to the administration about vaccine mandates for city employees? Are you considering it, weighing it?
Those are conversations that are ongoing. We haven't reached a final decision. We are talking to stakeholders within the city, talking to the unions.
All right, that's all I got. Thanks.
Thank you so much, Mike. Next up, we're going to move to David Melandra from Philly Sports Network. Go ahead, David.
This is a follow-up question to what Lauren mentioned earlier about. So with the Phillies and the Eagles still have games going on right now, will masks be required for outdoors with the concern about full capacities for them?
So we have not moved to a mask mandate, and we haven't been recommending that people wear masks outdoors. I will say that if somebody was going to be in a crowded situation with people right next to them, that's a place I would really think about putting a mask on. But in general, being outdoors is highly protective against COVID infection.
And what about for those who will be going to indoor concerts? Will masks be required for those?
So right now it's a strong recommendation. The thing I would say about going to an indoor concert right now is you definitely would want a mask. Going to any type of a crowded indoor situation with lots of people does present some real risk. The more people in a space, the more chance that somebody in that space has COVID. And the longer you're there, the more risk. If you're not masked, there's definitely more risk. So you're adding risk there.
All right, thank you.
Thank you very much, David. We're going to follow up with Matthew Rothstein from BizNow. Matt, you should be able to unmute now.
Great, thank you. So, as you said, it's a fluid situation, but, looking forward for the next few weeks, is there any reason to believe that case counts will stop rising or will turn in the other direction? And if not, why not, get ahead of case counts, hospitalization rates with mask mandates and other measures like that to head off that sharper increase?
The rise in cases is the reason that we're having the discussions right now about vaccine mandates. We're looking at the effects of the strong recommendation for masking. It looks like there was at least somewhat of an increase in correct mask use indoors. So we'll be watching that data as well and making decisions going forward based on what we're seeing with case counts, masking, hospitalizations, and the positivity rate.
Okay, so you're looking to see, how much time are you thinking for evaluating what this strong mask recommendation, what effect that has on case counts?
Well, some of this is that the conversations about vaccine mandates take some time to have, in terms of what that looks like, who we need at the table. So, we can't declare it today unless we know how we're going to do it. So that does take some time. On the masking, it depends what happens with, if mask use goes way up based on that recommendation and based on the data, that's a different story than if it bumps a little bit and then stops. So, again, we want to be as restrictive as necessary, but not more restrictive. And so that's how we're basing these decisions.
And as far as the vaccine outreach, are you more concerned at this point about people who are still hesitant about receiving the vaccine, or people for whom it's an outright refusal?
Well, just in terms of who we're going to be most likely to reach, it's the people still on the fence that we have the best chance at. People who are absolutely opposed to this, maybe they'll come around eventually, but in terms of investment of our time, reaching the people who are still thinking about it and haven't gotten around to it or need a little bit more information, we're just going to reach a lot more people in that group.
And I guess when I say concern, I mean in terms of concern about how much you can advance the vaccination rate. Do you, in terms of the size of those two groups?
The group in Philadelphia adamantly opposed to vaccine is considerably smaller than the group of people who are still on the fence. When you look at national data on this, it's a little deceptive. We don't have a lot of hardcore right-wing folks who are saying no for that reason. We do have people who are really concerned for, that they don't trust the science of it, but it's not so much of a political divide in Philadelphia as it is across the country. And so, some of the national survey results, I think, are a little bit deceptive there. We think there's somewhere around 10% of Philadelphians who just are adamantly saying no, no, no. sometimes no turns to yes.
Guys, it's great to be.
Question? Hey, everybody. There you go. Nicely done. Yeah.
But it's also a lot of fun.
Right now, breaking new details on this